Senator Kaine.
Thank you, Mr. Chair, and thanks to the witnesses. I think there is a consensus, not a unity, but a consensus that we've got to do something about this, and a lot of debate about what's the right way to do it. You know, the reality in Virginia, so I'm a parent of 3 kids. One is an early childhood educator in a private pre-K program, long-standing private pre-K program in Minneapolis. And I travel all around the state, talk to people at military bases and rural Floyd County and metropolitan Richmond, Hampton Roads. And whether I'm in a rural part of Virginia or in a really metropolitan part of Virginia, I hear the same story over and over again, that we can't pay our folks what they're worth. If we did pay them what they were worth, a whole lot of our parents couldn't afford it. And then from parents, I can't find affordable child care. And I'd like to be in the workforce, but I'm not because of the inability to find high-quality, affordable child care. At the same time as our unemployment rate is near the lowest it's been in 60 years, and every employer in the state is telling me we can't hire people, we have got a massive reserve army of super talented people who would like to be in the workforce, and they say they're not for one reason: they can't find high-quality, affordable child care. Ms. Mormon, my kids in Richmond did early childhood experience, some home-based family child care, some the Virginia Preschool Initiative, 2 programs in church basements that were church-run programs. And I support all of it, and I supported all of it when I was governor. And I guess you wouldn't be here today with us if you thought what we were trying to do was dictate a one-size-fits-all, Stalin-like government-run program, correct? You wouldn't come and testify to a committee if that was what was up. In fact, you were talking about the value of the funding that you received during COVID. The first set of funding was part of the CARES Act, which was bipartisan. Democrats and Republicans together said, we better help out child care providers during this tough time. And then we did more in the American Rescue Plan, and that was just Democratic votes, only Democratic votes. But in the American Rescue Plan, we did child care. We didn't exclude family-based care. We didn't exclude family-based care run by faith-filled people. We said, we need you. We want to support you. And the proposal that Senator Murray and I have is to do that. It's not to do a one-size-fits-all. It's to have a program that would support high quality, but high quality delivered in a million different ways, including programs just like yours. You were candid, and I want to dig in a little more because I thought you were candid on the salary issue. You're paying $12. The state says you can get some additional resources, training, if you can go to 17. But if you went to 17, how would that affect the parents who are coming to you?
If I went to 17, I would have to increase my rates.
And a number of your parents' families couldn't afford it, right?
I would lose them.
Right?
Yeah.
So this is the gap I'm hearing everywhere. My families struggle to afford this. My providers are worth a lot more than I paid them, but if I paid them that, then these families would be in a jam and you wouldn't be able to provide services to them. And that's the gap that I think we have to find an answer for. And I appreciate you kind of just stating it so clearly in terms of how it affects you, because I hear this all over the place. I want to thank you, too, as I'm just continuing. This work that you did during COVID to call all of these child care providers in the family settings to say, you know, if you were running a daycare center that had, 50, 60, 70 kids, you might be more aware of these resources out there. But like the place where my son Nat went first in life, there were 4 kids there. And Marie Williams, I doubt, would have known about federal funding available to help her over this tough time. What did you learn as you were reaching out to these 400 providers during this tough time that you might want to share with us?
The money was crucial. It helped them to continue to be able to operate and serve the children that they had in care. Without those phone calls, providers would have lost out because it was a deadline. There were no extensions. You had to act, and you had to act then. And many providers were not aware because they were working. They didn't have time to check emails or to see what was going on. They were working, caring for the children that were in care.
And just to, put an exclamation point on the value of the work that you did, this was also during a time where, because early phase of COVID, we don't exactly know, you were having to grapple with social distancing issues that you might not have thought about. 3-year-olds aren't the greatest social distances in the world, or so I've noticed. And secondly, you probably had a whole lot of parents who were facing issues at their jobs. And even as they were struggling to pay what you would charge them, now if their jobs are in jeopardy or businesses are closed down and things like that,
Right.
they had even more needs. But you were able to not easily kind of stretch, because of this federal assistance, stretch the fabric over the holes in the garment to kind of keep plugging along. That's what our assistance enabled you to do, correct?
Definitely. Without it, and some providers did not make it
Yeah.
because they weren't able to continue. Financially, they just couldn't afford to continue to run their business.
Well, thanks for being a resource for others, and I yield back to the chair.